Thank you for your interest in the Neuromuscular Fellowship at University of Florida in Gainesville. My name is Miguel Chuquiling. I'm the Associate Professor of Neuromuscular Diseases and the Neuromuscular Fellowship Director. The UF Neuromuscular Fellowship is an ACGME certified fellowship of 1 year duration. We take one fellow per year, and at the end of the training, the fellow will be able to take the ABPN and AANEM certifications. This slide shows our neuromuscular division faculty, starting with Dr. Weimer, who is the division chief with a special interest in ALS and involved in numerous clinical trials. Dr. Subramani has interest in myotonic dystrophy and other muscular dystrophies, and he's also actively involved in clinical trials. Dr. Trix has interest in transcranial magnetic stimulation. I have an interest in periodic paralysis, myotonic dystrophy, and neurology education. Drs. Slatky and Cingarello have interest in muscular dystrophies and SMA and are part of our pediatric neuromuscular faculty. Drs. Rivera and Jagnis are our pathology colleagues, and we have close collaboration with them in our monthly pathology review sessions. Dr. Gonik is our autonomic disorders expert. April King is our fellowship coordinator. Our division also includes EMG technicians, nurse practitioners, social worker, and other multidisciplinary therapists. I can also not forget to mention our administrative personnel and research coordinators that are essential to the work in our division. Regarding clinical sites, the main clinical hub is the Neuromedicine Hospital, also called NMH or East Tower, that is located in downtown Gainesville and is part of the three main hospital buildings of the UF Health Science complex. There is a tunnel that connects those three buildings. The UF Neuromedicine Hospital, or NMH, was opened in 2017 and is the host of our neuromuscular clinics, 3 EMG rooms, autonomic testing room, and is where the fellow will do part of the inpatient EMGs and neuromuscular consults. The Neuromedicine Tower is the location where all neurology-related activities take place. This includes the resident stroke, general, and consult teams, the resident continuity clinic, and other subspecialty clinics such as stroke, epilepsy, and headache. We also have a dedicated space for other neurodiagnostic modalities such as EEG and transcranial Dopplers, and also a fully dedicated neuro ICU. Regarding the UF Health Science Hospital, this is the main location where the fellow will perform inpatient consults and EMGs. UF Health Science Hospital is a referral center for the Northern Florida, South Georgia regions. It's a 1,000-bed hospital, level 1 trauma center, and a Joint Commission certified stroke center. The other clinical site for the neuromuscular fellow will be the Norman Fixel Institute for Neurological Diseases that was opened in 2019. This is the place where we have our multidisciplinary clinics, including MDA, ALS, neuropathy, and myasthenia clinics. We also have one EMG room, research facilities, and one wing of the location is dedicated to physical occupational therapy and other rehab modalities. The Fixel Institute for Neurological Diseases is just an 8 to 10 minute drive from the main UF Health Science Hospital complex. So there should be any problem getting from one place to the other. Regarding the fellowship clinical activities, we have neuromuscular clinics every day and also multidisciplinary clinics once a week, which include MDA, ALS, peripheral neuropathy, and myasthenia clinics. We perform 60 to 80 EMGs per week, and we also do inpatient consults and EMGs as needed. I would say the average of inpatient consults or EMGs is 2 to 3 per week. We have autonomic testing room and also do skin biopsies for small fiber neuropathy and research. This is an example of the Neuromuscular Fellow scheduled throughout the year. The rotations have been organized by 1-month blocks. The fellow will have 4 adult neuromuscular months, 3 electrodiagnostic months, 2 peds neuromuscular months, 1 muscle and nerve pathology rotation, 1 chemodenervation rotation, which includes Botox injections, and 2 weeks for a vacation and 2 weeks for research at the end. This slide shows the weekly clinical activities for the fellow during each rotation. The top left, we have adult neuromuscular clinic, where the fellow will have mostly adult neuromuscular multidisciplinary clinics during the week, but also a few EMG slots. During PEDS neuromuscular rotation, most of the activity is going to be dedicated to pediatric neuromuscular diseases, but also some of them are going to be adult neuromuscular and EMG clinics. During electrodiagnostic rotation, most of the activity is going to be dedicated to EMG and some adult clinics. During Botox rotation, 2 half days are going to be dedicated to Botox injections under movement disorder faculty supervision, and the rest is going to be a mix of EMG and adult neuromuscular clinics. And finally, during the muscle and nerve pathology block, 3 half days are going to be reserved for muscle and nerve biopsy reading under supervision of our pathology colleagues, and the rest is going to be a mix of EMG and adult neuromuscular clinics. You can also notice that 10%, usually Friday afternoon, is reserved for research activities for the fellow. Regarding the teaching or didactic schedule, we have a muscle and nerve pathology review session once a month, usually the 3rd Monday at noontime. Tuesday mornings are reserved for an EMG and nerve conduction studies lecture series. Wednesday afternoons, we have a monthly neuromuscular case review session and journal club. On Fridays at noon, we have a neuromuscular lecture series. This slide shows the topics that will be discussed during different neuromuscular sessions. In November and December, we have a neuromuscular lecture block that is shared with the residents. The fellow will give some of these lectures to the residents under supervision of the attending, but other topics will be covered by faculty. The neuromuscular lecture series occurs Friday at noon, and the EMG and nerve conduction study lecture series is Tuesday mornings. As you can see, this covers a wide array of neuromuscular clinical presentations and EMG diagnostic testing. Regarding research, per ACGME rules, the fellow is supposed to complete 1 quality improvement project during the fellowship, and is also required to do 1 neuromuscular project. The quality improvement project can count as a neuromuscular project depending on the fellow wishes. As I mentioned before, 10% of the week or 1 half day serves as research time, so the fellow doesn't have any clinical activities during that time, and he also gets 2 extra weeks dedicated for research during the year. The fellow is supposed to present the results in American Academy of Neurology, AANEM, or other neuromuscular conference, and also submit for publication. The fellow also will receive $500 as a book fund to be used to buy neuromuscular textbooks or subscriptions. We also have a fund for traveling to scientific meetings that are neuromuscular related. We will also pay for a neuromuscular ultrasound course. And the fellowship is enrolled in the AANEM training program partnership that provides access to the muscle and nerve journal, learning modules, and also self-assessment examination. The neuromuscular division at UF is also actively involved in research. This slide shows the clinical trials or studies that we have in ALS and primary lateral sclerosis and other motor neuron diseases. This slide shows our research regarding myotonic dystrophy, FSHD, mitochondrial myopathy, and CMT neuropathies. The neuromuscular fellow will actively participate in all of these studies as a sub-investigator. Our division also has other collaborative projects with institutes across UF, including the use of MRI and biomarkers in muscular dystrophies and other biobanking initiatives. Our division also has close collaboration with other institutes across UF, such as the UF Center for Neurogenetics, and the Neuromuscular Fellow can do a second year fully dedicated to research in a basic science project that is neuromuscular related. The optional second year of research for the Neuromuscular Fellow can also involve projects with the UF Myology Institute, McKnight Brain Institute, or the Powell Gene Therapy Center, and rehabilitation departments. Regarding Gainesville, this is a college town with numerous athletic and cultural events. We are home of the Gators, and basketball and football season are very big here. We have other activities such as botanical gardens, numerous hiking and biking trails, wetlands that you can explore. And this is a very family-friendly community with a nice place to raise kids. And we have an airport with Delta and American Airlines from where you can fly anywhere in the US. We are in the North Central Florida region, a 2-hour drive from attractions such as Jacksonville, San Agustin, Daytona Beach, Orlando, Clearwater, Tampa, and also a 5-hour drive to Miami. If you have other questions about our Neuromuscular Fellowship, please don't hesitate to contact us by email. I look forward to reviewing your applications.